Good afternoon, everybody. My name is Andrew Blands. For those of you who don't know me, I'm the Accountable Officer for NHS South East London CCG, and I'm also the Integrated Care System Lead for South East London. And I wanted to welcome you to this event and thank you for your time this afternoon. We've got a briefing session on the COVID vaccination programme that we're running right across South East London. Really grateful for your time at relatively short notice, and also to say that this is a South East London-wide event, and consequently we've extended an invitation out to over 300 councillors across our 6 boroughs. Consequently, and one of my colleagues, Lucy, will talk us through how we'll run the session in just a moment, but safe to say that we are aiming for as interactive a session as possible, but wanted to make sure we convey as much information which we know you are keen to hear at this time. Related to that, this is our first session of this kind. It may in truth be our last. We wanted to kick off in this way, but going forward, we'll be looking to have borough briefing sessions with elected members ×6, so locally, and do that on a monthly basis. We will also be seeking to publish twice per week a rundown of the latest information and developments for use by elected members, and we hope that will be of use as well. The aim of the session today, I think, is fairly straightforward. We want to provide you with that update on a fast-moving programme. You'll be aware of how fast-paced it is and where we are today. We absolutely, as far as possible, either want to answer your questions today, record them and come back if we have a lot of questions, which we may well do, or if we don't know the answer, to make sure we find somebody who does, and make sure that communication is good coming back. So after the event, we will also have a Q&A that we're building up along the way for colleagues. Last thing for me to say is who's here to help. So I'm introducing the session, but in a moment I'll hand over to colleagues, and one of those will be Jessica Arnold, our Director of Flu and COVID Vaccinations across the ICS. Sam Heffelwhite is joining us. Sam is not only the place-based director for the CCG in Southwark, but is also one of the joint SROs for the programme. Dr. Andrew Parson is here. He's a GP in Bromley, member of the CCG governing body and a clinical lead on the programme. We're also welcoming Kirsten Walters from Southwark Local Authority and from the Public Health team. And between us, we're hoping that we'll be able to respond as well as possible to your questions today. I'm going to hand to Lucy for some logistics and then rapidly over to Jessica for the content. Thank you again.
Hello everybody, I'm Lucy McCafferty and I'm the Assistant Director of Organisational Development for NHS South East London CCG. We have dedicated 25 minutes of today's agenda to answer some of the questions you might have in relation to the COVID vaccination programme. Once I've finished talking, I'll make sure that the Q&A section is live. Feel free to post any questions you might have about the COVID vaccination programme. When we get to the Q&A session on the agenda, we will publish all of the comments and the questions that you post, and we'll aim to answer as many as we possibly can. And as Andrew said, we will also be developing a frequently asked questions document after today's briefing, and we'll aim to get this out to you as soon as we possibly can. Without further ado, I'd like to hand you over to Jessica Arnold, who is the CCG's Director of Flu and COVID Vaccinations. Jessica, thank you.
Hello, good afternoon everyone. As colleagues have said, my name is Jessica Arnold. I'm the Director of Flu and COVID Vaccinations for South East London. Thank you so much for making time to join us today to talk about this important programme of work. I know that you'll be very, very busy, and I doubt very much that there's any of you on this call who hasn't had a contact from your constituents, from your friends and family, and indeed yourself working hard to understand what's happening in the COVID vaccination programme generally and in South East London, and to try to be able to help as well. We've had many contacts, some of them ranging from real interest and enthusiasm through to lots of anxiety and people quite rightly and understandably wanting to know more. So we are going to try to convey as much information to you as possible, very much echo colleagues' invitation to ask us questions, and we'll work through on that basis, and I'll make sure that I'm not talking for too long, so you do get the chance to have your questions answered. So the vaccination programme, day 37. I've put day 37 onto this slide because we are on day 37. On the 8th of December, we received our first supplies of COVID vaccine, and here is a nice picture of one of our Bromley residents and active patient members being vaccinated in front of the Prime Minister. So we are now into that programme, and a lot has happened, and it's happened very quickly and usually with not too much notice. I'm going to assume throughout this presentation that you've got a working knowledge of the COVID vaccine state of play in the country, and that you keep on top of the news in terms of what's been happening since December. And I really want to concentrate the time that we have on what the challenge here is here in South East London, in your boroughs, how we have mobilised, the achievements that we've had to date, and what's going to be coming in the coming weeks and months. The slides will be circulated afterwards, so there's no need to frantically write down this information. And given the huge amount of public interest and the importance, as I've said, we will get communications over to you on a regular basis to make sure you're kept updated. So Simon, next slide, please. OK, so the Joint Committee for Vaccination and Immunisation sets the priority cohorts for patients receiving COVID vaccination. There is no local discretion in South East London over these groups. These are the groups, they're the same whether you're here in South East London or any part of the country, and we don't have any discretion over how quickly we can move down through them. So we are working from the top downwards and working very closely with colleagues in NHS England and others to work through. I've drawn a line into the first 4 cohorts, and we'll talk a little bit more about some of the targets that we have to vaccinate everybody in these cohorts, or everybody who wants vaccination within these cohorts, by mid-February. Then the following cohorts, so all of the vulnerable people by spring. And just to say that those top 10 cohorts, before you get down to the rest of the population, account for around about 99% of the deaths that we've had from COVID. So although there are healthy people out there who have died and have been affected, we believe that by the spring we'll be able to work through these cohorts and keep people safe as far as possible. I think it's important to show this slide because even though it's not South East London specific, the nature of many of the questions that we've had and the understanding of the programme is linked very much through to these JCVI priority cohorts. Next slide, please, Simon. So how are our population receiving the vaccine? When I started work in this role a couple of months ago, before we had an approved vaccine, there were only 2 ways that it was planned nationally to deliver vaccine: through large vaccination hubs and through going into people's homes. Since then, we've seen hospitals, primary care and pharmacies added to that list. So it has been rapidly evolving. And as we've learned more about the vaccine itself, its characteristics, and how it can and can't be transported and given to people, we have adapted accordingly. So I'm going to go through each of these 5 delivery models in a little bit of detail so that you know what the offer is available to our people in South East London. So our hospital sites delivered by our NHS trusts are delivering large numbers of COVID vaccination at the moment. We have Guy's, St Thomas's, Lewisham Hospital, King's at the Prue and King's at Denmark Hill. They've been operational for some time now. Lewisham went live a bit later than the others, just after Christmas, and the other sites have been live since December. From tomorrow, we will also have Queen Elizabeth, Queen Mary and South London and the Maudsley Hospital at Denmark Hill also providing vaccination. So lots of vaccination going on at our hospital sites. In general practice, it would not be feasible, either due to the nature of the vaccine and the amount of supply that has come through so far, for all of our general practices to individually be doing their own thing to set up vaccination. We've got over 200 practices in South East London, but thankfully about I suppose it was about 2 years ago, was the advent of primary care networks, which are collaborations of GP practices working together. And through those collaborations, they've been able to provide the premises, the workforce, the management oversight and everything else that you'll need to offer COVID vaccination. So we have 16 sites. They're up and running in primary care, open at the moment in general practice. The first ones went live in mid-December. Just to be clear, that's not 16 GP practices, that's 16 sites of collaborations of GP practices. So we have many already open, and the final 6 are due to open this week. So today, tomorrow and Friday, we have more primary care sites opening, and they will be receiving their first vaccine supplies. So what that means is anyone who's registered with a GP in South East London will be covered by one of these primary care network sites. We'll get on to some of the questions that have arisen around how people can access the vaccination through their practice. The next one's mass vaccination centres. So we knew this was coming. I mentioned that this was the earliest delivery model for COVID vaccinations, and we have identified initially 1 site per borough in South East London to be a mass vaccination centre. We've secured those sites. We know that they're suitable, they've been assessed, and they're ready to go. When they have COVID vaccine, they will be open 8 till 8, 7 days a week, perhaps not very initially because there's no point in opening if there's no vaccine, but as the vaccine comes through, they will have the capability to open for that time. And between them, we'll be able to offer up to 40,000 vaccinations per week. So to set that into context, in our hospital sites, so the ones that I mentioned before, we've got between 1,000 and 9,000 vaccinations being delivered a week. In general practice, we've got about 1,000 or 2,000 per primary care network being delivered. And when we have our 6 sites, we'll have 40,000 vaccinations being delivered. One of the questions that we've got, that we've had quite frequently has been, why don't you stand up these sites now so that we can be getting through these numbers now? And the answer to that very quickly, although I'm happy to go into more detail, is we don't have the vaccine supply coming through. It's great that we have 2 and now 3 vaccines approved for use, but there's obviously a process behind that to actually get the vaccine out. We're also delivering a lot in our hospitals and our primary care at the moment, and that's ramping up quite quickly. So we're ready to go with mass vaccination centres, and they will be coming online in coming weeks. Community pharmacies is the newest model that came out in late December, not long before Christmas. Unfortunately, many pharmacies, this isn't really like the flu programme where you can go into any pharmacy on the high street and get your flu vaccination. Many pharmacies don't have the premises that you would need to be able to safely deliver COVID vaccinations. So you need patient flow going through a front door out a back door. You need people to be able to socially distance. You need space for people to sit for 15 minutes after they've been vaccinated to be observed, and many pharmacies can't do that. However, there are 7 pharmacies that have come forward wanting to provide vaccination in South East London, and we hope over the next couple of weeks we'll be able to go live with them, so not too long to wait with that additional capacity. And then finally, all 4 of those models I've discussed so far involve people going for their vaccination, leaving their home to go out. We know that not everyone is able to do that, so we are looking at roving services that will be able to go into people's homes where they are housebound and vaccinate them at home. The challenge with this one, and again anticipating a question, obviously the people who are housebound are amongst our most vulnerable patients, our most vulnerable people. The nature of the vaccine and how it can be transported, and the dose, the quantities that it comes in don't lend themselves to giving single doses very easily that can be moved around. So we're not behind in this respect, but it is a model that we will be seeking to step up as we get more vaccine through, and as that vaccine becomes easier to move around. Next slide, please, Simon. So there's a lot on here, and it was partly with this slide in mind that I said, don't worry about writing everything down, we'll send these slides out. But between all of those models that I've just talked about, with the exception of the roving services into housebound patients, you can see a programme that is stepping up over time to deliver up to potentially 100,000 doses to South East London residents per week. And when we have security of vaccine supply coming through, we will be able to stand these up, and recognising there's still a bit of work to do around the pharmacies as well, and that's being worked through in the coming weeks. What this doesn't cover explicitly on this slide is around care homes, and our care home residents are being vaccinated by their primary care networks through local arrangements where they exist as well. So care homes aren't missing here, but there was no need to set up a separate service to vaccinate care homes, because we have really good services in our boroughs actually for providing care to care home residents, and we are using those. Next slide, please, Simon. Thank you. So headline progress to date. I talked about day 37 and the ramping up of the programme. So we've delivered 39,000 vaccinations up to the end of last week, so up to the end of Sunday. But of course, we're now 2.5 days vaccinating at our hospitals and at our practices. So I would expect that figure to be more in the region of around about 50,000 vaccinations given so far. We've got our hospitals delivering and more to follow, which I've covered. Vaccination of health and social care staff is ongoing. So you will have noticed in those JCVI cohorts, and I'm sure you're all aware from keeping abreast of the programme, that health and social care staff are part of those eligible groups. We are working through and asking people who work in health and social care to come forward. This is not the easiest process, because if you work for a healthcare organisation like a hospital, for example, it's quite simple really. Your employer will book you in for vaccination. It's relatively straightforward, but I am conscious that particularly the NHS and councils contract with many smaller organisations, some of them private, some of them voluntary sector, who provide what I would call general social care services, so not social workers, but providing care for our population and for our most vulnerable people, some of which is necessarily patient facing. So we are working closely with councils to make sure that those people are called forward for vaccination as soon as possible. I've mentioned our primary care sites are open, and we have 6 more this week. I've talked a bit about the vaccination of care home residents, and certainly the approval of the Oxford AstraZeneca vaccine will make that more operationally easy. And the national booking system went live. So not that I'm the most technical person, but we now have in England a national booking system for large-scale centres. The idea is that people will be able to book to go to mass vaccination sites. Now in London we only have the Excel Centre open, and although that might be convenient for some of our residents thinking more over Greenwich Way, maybe Lewisham, it's not a South East London site, so some people have been called to that site for their vaccination, but certainly when our sites, those 6 sites that I mentioned, 1 per borough, go live, we'll be able to take advantage of the national booking system, not as the only way to book, of course, because not everyone will be able to go online and do that, but as an option for some people's convenience and to get them booked in. So these are some of the progress we've made so far. Next slide, please. So targets. So I'm sure probably every one of us was glued to the television. I think it was Tuesday night of last week, which is hard to imagine that was only just over a week ago. And watching the Prime Minister announce that we were sadly going into national lockdown, but the vaccination programme target is to deliver vaccination to everyone in those top cohorts, those cohorts 1 to 4, by mid-February. So all of our care home residents and staff, all of our health and social care workers, everyone over 70, and including the shielding population, so all of the people who have been deemed extremely clinically vulnerable. We have modelled this through in South East London, and we know that we need to reach 240,000 vaccinations in order to achieve this. And the modelling, which I will show you in a second, suggests that we are in a comfortable place to do that. I'm not saying it's going to be easy. It's not going to be easy. It's a huge, huge endeavour, but we have the infrastructure, we have the workforce, and we will have the vaccine supplies, we're assured, sorry, to be able to do this. A further target has been set to vaccinate all of our care home residents, and just to demonstrate how rapidly moving this programme is, these slides were pulled together yesterday, and already this morning that target has changed. So we're now aiming to vaccinate all of our care home residents by the 17th of January, with the exception of some that will be the week after, going through our primary care networks, which we're only opening today. I don't think it would have been very fair to ask them to open today or tomorrow and then vaccinate all their care homes by Sunday, so they'll have slightly longer, but most of our care home residents will be vaccinated by the end of this week. Next slide, please. Thank you. This is the modelling. There's huge data sitting behind this, which you'll be pleased to know I haven't brought here, but the orange dotted line going across the middle there shows the target. So we know of all of those 4 cohorts of patients that we have about 242,000 people, and we've modelled through across all of those sites. And again, thinking back to that really busy slide that I just showed you with all of the different models and sites on it, that we'll be able to meet our target around about the end of January, all things being well, but certainly hopefully comfortably by mid-February. Next slide, please. So apologies for the really dense amount of writing on this slide, but I think it is important to talk about how we're communicating, because I suppose arguably the most important thing is that we're getting on with the work, and we're able, our system is able to actually vaccinate people. That's what's going to keep people safe, but actually communicating and getting everybody on board and knowing what's happening and allaying some of those anxieties is really, really important as well. So we have campaign resources in multiple languages and formats that are available online. We've been advertising through social media, but also the good old-fashioned way as well, through posters and other ways that we know through our long history and commitment to public engagement work and reaching our population, digital and social media as well, and we'll come on later to how you can help us with this. Events that we've been holding, so community events, faith leaders events, etc., and working with Health Watch and trying to communicate with people in as interactive a way as possible. Public relations, so we might have had 1 or 2 quite big names coming to South East London sites, being the first to use both the Pfizer and the AstraZeneca vaccines, and we've been able to use that as part of our media coverage to give people confidence to come forward. Organisational development, training as well, to help our staff, our community representatives, as stakeholders become ambassadors of the programme. Stakeholder engagement, and I suppose this is what this is now, recognising that our councillors and our MPs are elected representatives of their constituents, and absolutely we have a commitment, but it's not a one-way commitment that we give you all the information and you go off somewhere and tell people about it, but actually we want to hear from you. We want your ideas. You know your populations, your communities, your residents very well, so we do want to work with you and capitalise on that. Insights as well, so we've been doing some behavioural work around what messages reach people effectively. So there's an insights piece of work which started with our flu campaign, and we've been able to capitalise on that. And finally, staff engagement. So between our local authorities, our hospitals, the wider NHS, etc., we have a huge number of staff who are not only the people that we need to vaccinate, but they're our family members, our neighbours, our friends as well, and they too are our ambassadors for the programme. So a huge amount of work going on to communicate progress of the programme. Next slide, please. OK, right, that's the end of my pre-prepared information to give you around how we're doing. Before we got to questions and answers, there has, as I mentioned, there have been a huge amount of inquiries going on, and I think it's a real testament to the enthusiasm and the keenness and interest that we've had from our population at wanting to have the vaccine. I remember when I started this role that we were talking about, what if nobody comes forward? What if nobody wants a vaccine that's relatively recently approved? And it certainly doesn't feel that way, that's the case. So that's really very positive. I've got 8 questions here that I've been asked many, many times, and I'm going to run through each of them because hopefully that might help, and then we can pick up anything afterwards that hasn't been covered. So there's a question around equity across the system. So why hasn't my family member who is over 80 been invited yet for a vaccination? I mentioned that we had hospital sites delivering vaccine initially, and they were delivering to people who were under their care, so people who had been recent inpatients or outpatients, and we have some but not all of our primary care sites up and running. So if you're a patient or a person, sorry, who's not under the care of Guy's or King's, and you happen to be registered with a GP practice that hasn't been able to go live yet, then you might not have been invited for vaccination yet. So there is something about the ordering of these sites going live, but also, and I know you will know this, but I'm just going to say it in a really clear way, there's huge amounts of the population who are simultaneously becoming eligible for a vaccination. And although we are absolutely confident that we will be able to vaccinate them by mid-February in line with the target that we've been set and the vaccine that we'll have, we can't vaccinate them all in the first week of January or the second week of January. So there is something about managing expectations, that we can't vaccinate people simultaneously, but they haven't been forgotten, and they will be invited. Another question that I've been asked is, why can't we offer vaccinations in pharmacies like we do for flu? Hopefully I've covered that one off in my earlier part of the presentation, and it is around really the nature of the vaccine and the nature of the social distancing that we're having to obviously abide by with strict adherence to keep everyone safe. So we do have some pharmacies, but we can't roll it out to them all. Why hasn't my neighbour, who is 99 years old, been prioritised to the top of the list? That's an example there. The JCVI cohort is over 80s, and because we are working down through lists of people who sit within the clinical IT systems of the GP practices or the hospital, they're not in age order. So we're not going to the 100-year-olds first and then the 99-year-olds. We are calling people as quickly as we can, but above that 80-year that age of 80 cut off, there will be some people who are older than 80 who haven't been vaccinated, and some 80-year-olds who have. So please bear that in mind. I have also had some reports of people younger, so people 70, 72, 74 being invited for vaccination. That has happened a little bit. It shouldn't have, but I believe kind of generally there's been a pragmatic approach whereby someone who, for example, is attending an appointment with someone who's over 80 has been offered vaccination. And I mentioned that the Excel Centre as well is the first mass vaccination site that's been opened, and that will have gone out to some people who are slightly younger. So please be assured that that's not the general policy. We are working down through the JCVI cohorts in order, but I know there are some people who are kind of over 70 who have been vaccinated. So that's just something we have to manage as a knock-on effect of what's going on. Why is my second dose being delayed? Does this mean that I won't be as protected? I'm not a clinician, so I'll give you my understanding, and if there's detailed questions, we can work through this. So the national decision has been made, and you will have seen this on the news, to vaccinate more people and try to keep everyone safer by having a greater population coverage of the vaccine by delaying second doses. Subsequent studies have been undertaken, and they've shown that after 4 weeks of having your first vaccination, the average person is 89% vaccinated, or the efficacy, sorry, is, you can tell I'm not a clinician, the efficacy is 89%. So it's not really low, it's not 50%, it's not as good as it will be, but generally as a population we'll get that protection. I've also heard some reports of people saying they've had their first dose and got COVID. Well, that's because it isn't 100% vaccinated. And I don't want to spoil the surprise, but there will be people who've had both doses and they may still get COVID because it's not 100% effective. But we all kind of understand that, I think, and those will be very isolated cases. So coming towards the end, and I'm conscious I've been speaking for a while now, so I'll stop in a moment. Have you thought of this site or that for mass vaccinations? Lots of people coming forward saying, have you thought of this school? Have you thought of this pub? Have you thought of this leisure centre? Really, really helpful. Thank you very much for that. We have been scoping mass vaccination sites for some time, and because they will be used when we've set them up to deliver to the rest of the population. And if you remember my earlier slide about that kind of rest of the population, group 11 under the JCVI groupings, we'll need them for quite some time. So the fact that some of these sites are open, are available now, doesn't mean they necessarily will be, and we believe we're covered off with the 6 that we have. Why are people having to wait outside in the wind and rain? That's really unfortunate. We are working with individual sites, particularly primary care sites, to try to manage this, but I am conscious that there has been some press around people waiting in the bad weather. It's just, to an extent, the message has been, please don't turn up for your vaccination early. And I know that's a hard message, and people certainly don't want to be late, and some of them will be travelling, but people are turning up early for their vaccination, and there's then bottlenecks. And of course, we can't have lots of people waiting inside. We have to abide by social distancing as much as possible. How can I help? We've been asked over and over, which is really lovely and testament to the amount of volunteers that are out there at the moment who do want to help with the programme, and there are many avenues to do that, so you can check out our website and you can go online, and there's lots of opportunities to volunteer. I know that some of our GP federations as well are doing their own advertising to get people to come and work within practices, so there's lots of ways to do that are publicly available. And finally, how are you calling people for vaccination? Because letters are taking a long time to go through the post. This is absolutely true. I received a Christmas card yesterday from someone who sent it before Christmas, and that that just shows how bad the delays are in the postal service at the moment. Since getting this inquiry, we've scoped out our GP practices and our hospital sites. They are not sending letters in the post, they're telephoning people or they're text messaging people. The letters have come to invite people to the mass vaccination centre at the Excel, so it's relatively small numbers, hugely frustrating for those individuals who will have been waiting, who will see that the date at the top of their letter was sent some time ago and it's been held up, but we have escalated that this morning to NHS England and asked them to look at other ways to speed through letters where they absolutely have to be sent, but in South East London that is not the policy of any of our vaccination providers. So hopefully that's covered off at least a few of the questions. I think I'm handing back now to you, Andrew, to take us through questions. Thank you, everyone.
Thank you very much, Jessica. I will limit myself to thanking you and to colleagues. I think we've got around about 100 elected members on the call now. Lucy's been keeping an eye on those questions that have come through and published them as we go. And I think Lucy's going to try and direct them amongst our team for the next few minutes.
Thank you, Andrew. Okay, so we had approximately, we received 31 questions and there's still more coming through. So we'll seek to answer as many as we possibly can. The first question I'd like to pick up is, and I'm going to ask Andrew to answer this one if he doesn't mind. Will the CCG commit to publishing regular weekly updates on ward uptake of vaccinations?
I think back to my sort of opening, we're going to aim to have twice weekly updates on our position, and I think our aim, quite aside from what the CCG would like to do, I think nationally we'll be seeking to publish that kind of information as soon as it is available and validated and reviewed. So I think that's where we are today.
Great, thank you, Andrew. The second question I'm going to field to Jessica, please. The question asked is, will we be able to have borough by borough trackers, i.e. ex-residents over 70 in Lambeth have now had the vaccine, /Y residents this week have had the vaccine, have you had yours, would be more meaningful than national statistics, especially in spring stage?
Yes, we can do that. I just want, and we will, we are expecting information to come through that shows borough uptake, and we will share that as part of that sharing that Andrew's mentioned. It has been a bit limited to date because if you cast your mind back to how I described the hospitals coming online, those 3 hospitals were the main ways that you could get vaccinated in December, they were drawing patients from all over South East London, so it has been a bit difficult, but when we get the borough level information, we'll be able to share that.
That's great. Thank you very much, Jessica. I'm going to direct the next question to Kirsten. And the question is, Kirsten, do you agree that all emergency workers, i.e. the police, ambulance, fire and shop workers should be vaccinated ASAP as they are meeting the public more and as a result probably spreading their virus, e.g. police dealing with demonstrators / domestics?
I understand that the considerable anxiety amongst frontline workers. I think it's important that the primary point of this vaccination programme in the first wave is not about preventing transmission, it's about protecting people from severe clinical disease. That's why we have the current priority groups, because all the evidence and data shows us that it's older age groups who are having the most severe disease. That's why we have the current prioritisation process, and from a public health perspective that makes absolute sense in the first instance.
Thank you very much, Kirsten. I'm going to ask the next question. Dr. Andrew Parsons, if you wouldn't mind answering this one, please. The question is, how easy will it be to revaccinate everyone in 12 weeks after their original vaccination?
Thank you, Dr. Andrew Parsons, GP. So the vaccination coordination is done through the site that you've had your vaccination. All vaccinations received are then sent back to through the electronic systems that are in place, so it's recorded on your GP medical record. So what will be happening is you'll be given an appointment. Generally, when you come for your vaccination, you'll be told when your next vaccination appointment is going to be. So one of the important things about setting up all of the vaccination hubs, etc., is to make sure that they can keep working, keep being staffed, which is why we're putting so much effort into getting them established and getting them running, to make sure that we can absolutely deliver the next set of vaccines 12 weeks later. Depending on also your clinical needs, sometimes it might be done earlier.
That's great. Thank you very much, Andrew. The next question, Jessica, I'd be grateful if you could answer this one. And it's been asked in different ways a couple of times. The question is, when will the CCG have data available to take up by Black, Asian, minority ethnic residents broken down by borough?
We're hoping to get this for South East London in the next few working days, and then broken down by borough after that. I can't give specifics because it's quite a frustrating situation whereby we can't pull the data off ourselves, and it is all going through the clinical IT systems that I mentioned. So the data is coming. It's not within our direct control, but we will have that and be able to, of course, share it as well.
That's great. Thank you very much, Jessica. Dr. Andrew Parsons, would you mind answering this next one again for me, please? The question is, if you have had COVID, is it okay to be vaccinated?
Yes, absolutely, because if effectively what's then happening is your COVID vaccination is giving you a booster to any antibodies or T cells that you have to fight the infection. The current recommendations that are set out suggest that if you've got active COVID illness or symptoms, then you postpone your vaccination, and the recommendation is approximately 4 weeks from the start of your symptoms or your positive test, but you should still have the vaccination course.
That's really helpful. Thank you so much, Andrew. Jessica, if you wouldn't mind answering this next one, why is London receiving a smaller number of vaccine doses per head than other parts of the country, and when will this be rectified?
I don't know if this is the case. I don't believe it to be. So I don't think we are getting less vaccine than other parts of the country per head. I'm happy to go and verify that and confirm back. But yeah, it's not something that we've been aware of, and I link in with NHS England London every day. So
great.
I'll come back.
Thank you, Jessica. We can always double check that one and add it to the FAQs that we aim to send around as soon as possible after today's session. Jessica, I'm sorry, could you just stay here for one more question, which is, I understand one local GP hub is now vaccinating the 70 to 79 age group, while other hubs haven't completed the over 80s and clinically extremely vulnerable in the 75 plus group. Why is this, and can it be adjusted? And I know you picked up on this in your presentation, so it might just be another one to clarify. Thank you.
Yes, thank you. They absolutely shouldn't be, and it's really, really difficult because that hub probably is very enthusiastic about reaching everybody within the timescales, but it has been absolutely clear that any PCNs that they need to stick with their over 80s. There can be some pragmatism, as I mentioned, if someone's coming along on site with someone else, but generally that's not the rule, and that primary care should be offering mutual aid to other PCNs who are maybe struggling more with their over 80s. So it's not to name and shame at all, but just to ensure we manage patient expectation and equity. If whoever's put that up wants to send me a separate message on which PCN hub that is, I can pick it up with them and just try and smooth it over and make sure they are on the right side of the rules that we've been set.
Thank you very much, Jessica, and we will be sure to share details of and email addresses for those of you that don't have Jessica's email address. The next question, Kirsten, if you wouldn't mind answering, the question is, there is a confusing message about pregnancy in the vaccine and also whether it impacts on fertility. Some younger women are reticent to take the vaccine until we know the impact is not significant. This is particularly relevant to care workers.
Thank you. Yeah, that's a really good question because we hear that a lot, and I think it's really important to understand where that has come from. And this was started by a German epidemiologist who who doesn't like the deployment of vaccines during pandemic and is tied up with lots of conspiracy groups. And where this has come from is that if you think about coronavirus, it's quite a spiky virus, and on one of the spikes it shares a little bit of genetic code with the placenta. When I say a little bit, it's like having a mobile phone number when you've both got 8 in the digits. And this anti-vaccine group made an application to Pfizer to stop the deployment of the vaccine because they said that it could, if it produced antibodies against coronavirus, it could also produce antibodies against the placenta, although they admitted that there was no evidence for this. And there is no evidence. And in the rollout of the vaccine, and almost 40,000 people, everybody was tested, women were tested for pregnancy. And they were excluded from the trial, as is normal when you are having vaccine trials. But during the trial and the rollout of the testing stage, equal numbers became pregnant. So there is absolutely no evidence that it impacts fertility. And I think it's important when we think about where these concerns are coming from. They're tied up in a lot of anxiety about vaccination programs being used for population control. But I think it's really important to be able to answer the question honestly about the science and always direct local residents to talk to their practice nurse or their GP and they can talk through these concerns.
That's great. Thank you very much, Kirsten. And actually, if you wouldn't mind staying there, I'm just very aware of the time. We're just about reaching 1:15, so we'll take one more question. Kirsten, the question is, how should people travel safely to the vaccination centre? What happens if they have no money for a taxi?
So if they don't have COVID, they can travel normally on public transport. There's no public health reason if people are taking appropriate precautions in terms of face coverings. If people are symptomatic, so they have a positive COVID diagnosis, then they should delay their vaccination. And that's because they will be unwell and they shouldn't be travelling and they'll be symptomatic. But I think about how people travel in terms of money is not generally a public health question, but there's no public health reason why people cannot travel safely, keeping social distancing, making sure they're washing their hands and making sure they're using a face covering on public transport. Does that answer the question?
It does. Thank you very much, Kirsten. And if we need to elaborate on that question, we'll certainly add it to the frequently asked questions document. Apologies, we've had 52 questions, which is fantastic. So thank you very much for taking the time to post those. As I said, we will push to make sure that we've got a frequently asked questions document and we'll answer as many of the questions as we possibly can and get those out to you. And now I'd like to hand you over to Sam Hepplewhite, please.
Thank you, Lucy. Hello, my name is Sam Hepplewhite and I am the CCG Borough Director in Southwark, but I'm also the joint SRO for the COVID vaccination programme in South East London. Could I possibly have my slides, please?
Thanks, Sam. We'll make sure those put up.
Lovely, thank you. So if we could just go to the next slide, please, Simon. Lovely, thank you. We acknowledge that we need to help you to help us and the local residents and staff that work in South East London. So we have developed, with the input from some of you, some key messages which very much align to the national messages. Our key message for the public would be that the NHS is working hard to deliver the vaccine as quickly as possible to adults in priority order. And so the overarching and recurrent messages are, please don't contact the NHS to seek a vaccine. The NHS will contact you. And as Jessica has alluded to earlier on, we are aware of some of the issues and challenges around the postal system. So we are working to make sure that other ways are used. When the NHS does contact you, please attend your booked appointments. And this is going to be particularly important because we need to make sure that people feel confident and safe to go to their appointments, and we reduce the amount of wastage and therefore people not turning up. Please continue to follow all of the guidance to control and spread the virus and save lives. And I think this aligns to the advice that Kirsten just gave us. And then link in with us and amplify the messages being shared with your networks. We do understand that the power of social media is incredible, and so actually the good news stories and the information and the positive information we need to share. Could I have the next slide, please, Simon? Thank you. So we need to ask your help to help us to identify any other communities or groups who are not easily accessing information. Support us to ensure communication is targeting these BAME groups and low-income families. So as the evidence suggests, that these groups are less likely to want the COVID vaccination. We need to collectively focus our efforts on reducing inequalities and improving uptake in the underserved. This involves ensuring the needs of people who may be disadvantaged or suffer inequity, leading to or arising from reduced immunisation uptake, are addressed as a priority. We need you to share any insight you have at all with us to help us understand how COVID vaccination messaging is being received. We need to work closely with you and a range of community groups and leaders to provide information, dispel myths and effectively engage groups who may be vaccine hesitant about vaccination programmes. Central to tackling this is a need for community engagement and promotion based around improved communication strategies and effective clinical leadership. Use your social media platforms to amplify and promote positive messages about the vaccination campaign and trusted sources of information. And finally, share positive video content about the importance of having COVID vaccinations. I think that's the end of mine. So thank you very much for your time. I think I'm going to hand back to Andrew now.
Thank you very much, Sam. Now, Lucy, I don't know if you feel we've got a moment or two more for any questions that we weren't able to pick up or any fresh questions that came through for Sam. I'd be very grateful to do that, and perhaps I will close us on time, but I see we may have a couple of minutes for that, Lucy. Is that okay?
Absolutely. Thanks, Andrew. So we have here, I'll work my way backwards. We've now had 56 questions, so thank you again. Sam, I don't know if you would mind answering this question, but the question is, what if you have no local GP to call you to vaccination?
I'm sorry, Lucy, I didn't catch that, sorry.
Sorry, the question was, what if you have no local GP to call you to vaccination?
Oh, so we're talking about unregistered patients who have no GP. OK, so I think what we would need to do is make sure that we're directing people to the information that's on our website on how to access COVID vaccinations. But it's an incredibly important point because not everybody has access to a GP, not everybody has access to a digital format to be able to get that information. So we would be working with local community groups to ensure that they have the ability to get a COVID vaccination appointment.
That's great. Thank you very much, Sam. Sam, I don't know if you want to stay there, sorry, because one of the questions, or Andrew Dr. Andrew Parsons, if you wouldn't mind answering this one. The question is, it's very hard to get through to many GPs on the phone at the moment. It's probably more of a statement than a question. I don't know if you can explain how you're managing the phone lines in your surgery.
In my surgery, well, okay, you're absolutely right. There's an enormous pressure on GPs at the moment. This isn't just for vaccine. This is because of the huge amounts of COVID out there and what we're doing, and the fact that we have to essentially triage everybody because we want to see people safely in our buildings. So we've got vulnerable people coming down to the building, so we have to screen out infections, and we have hot hubs where we see people with COVID infections. So you can get through on the phone, but you can also get through digitally by doing things called e-consults. We have texting services as well. So we've got a number of different ways of getting information. In terms of getting your COVID vaccination invitation, remember, it's not about you phoning us to ask about it. We are going to contact you, and at the moment we are going to be phoning you. And everyone else who asks me, I say, be ready for your call. This is the group, you're in cohort X, and you're going to get a phone call at short notice. Be ready to be contacted. I'll stop there and we can do another question.
Thank you, Andrew. While you're there, the question, an interesting question is, will couples be offered their vaccine appointments together?
It's a very good question, one I get asked all the time. I suppose what we have to do is we are guided about how we give that vaccine out through the cohorts. So I suppose the question is within reason. Now, if you're 80 and your partner is 50, then, you know, if the partner who's 50, we give the vaccine, then we're not giving it to somebody else who's 80. So we have a duty to be responsible about the vaccination. But we would take particular circumstances into account. But generally speaking, we are trying to follow the cohorts because, as Kirsten alluded to earlier, we know from the studies that have been done that if you vaccinate X people of a certain age, you protect so many people than if you give the vaccinations out to younger people. And that is the priority at the moment.
Thank you very much, Andrew. Kirsten, did you just want to come in on top of what Andrew just said?
No, I don't have anything else to add unless anyone has any questions.
Great, thank you. Jessica, could you answer this next question for me, please? The question is, will district nurses vaccinate vulnerable housebound people not living in care homes?
Okay, so we haven't fully worked through the plan for housebound people because we are still waiting for confirmation around how we can move that vaccine around, so things like storage and logistics. However, we are conscious that there are huge demands on district nurses at the moment as well, because there's the whole business as usual of what they would be doing at this time of year. And actually our housebound patients are known to their GP practice. So I would say, I'm not ruling it out, but I would say actually it's probably more likely that the GP practice will be working with local systems, which might be their GP federation, it might be others, to vaccinate housebound people as well.
Thank you.
I see Andrew's nodding, so that's always a relief.
No, I agree. I think it's all hands to the pump at the moment, and I suspect we'll be working with district nurses, with our GPs, our own practice nurses. We'll be doing things that we don't do normally because we want to get the job done.
Yeah.
Thank you very much, both of you. Sam, could I ask you to come back to this question? We've had another question which relates to GP registration. So we may need to just make sure we pick this up in the frequently asked questions document. But the question is, so do you have to register with a GP to get a vaccine, and how long does that take? And if the answer is yes, you do, perhaps we can just talk through how people would do that.
So you do not have to be registered with a GP to get a vaccine. GPs are able to vaccinate non-registered patients. I think and how long does it take? It depends on whether all the information is available, but it shouldn't take any time at all. If you do need to register with a GP, it's can happen very quickly. However, I think the issue here is, how do people who are not registered with a GP know about the appointment and get to that appointment? And I think that's a really good point that we need to cover in our question and answer session. But to answer the original question, no, you don't have to be registered with a GP.
Thank you very much for clarifying that, Sam. That's really helpful. Jessica, I'd be grateful if you could answer this question. It's another really interesting one and links back to the answer you gave around BAME communities. The question is the private sector getting any vaccines? The private sector does not just care for the affluent. Some minority communities use private mother tongue GPs.
There are no plans in South East London or nationally for private GP services to be delivering the vaccine. In the slides that I presented, you can see that within the NHS resources that we are confident that we will be able to vaccinate everyone who needs and wants vaccination. So we're not deploying that, but nor is anyone else nationally. This isn't the question, but just to give some confidence, the clinicians and staff who work in private sector GP practices or elsewhere are being offered vaccine as well, and recognising that they are often patient facing as well. So they will be vaccinated, but they won't be giving the vaccine. It will go through the NHS.
Thank you very much, Jessica. And if you could stay there, the next question, what contingency plans for vaccination are being put in place for people with disabilities, especially those with learning disabilities? There has been considerable loss of deaths within this group, ? Thanks.
Hugely important question. Thank you for that. So people with learning disabilities fall within the JCVI cohorts, which are, I think it's cohort 6, so it's not the now to mid-February group, but it is the before spring group, because learning disability is deemed to be an underlying health condition that disproportionately affects people, and therefore they're in that cohort. As soon as we are allowed nationally to move down through the different cohorts and vaccinate people with learning disabilities, we will do so. For those people who live in learning disability care homes or kind of residential settings, we will work with their care providers. So one of the good things, I suppose, that's come out of the pandemic is we've done a lot of work over the last 10 months or so to make sure that every learning disability care home in South East London has got a named GP who is providing an enhanced level of care to those people, and we will work through those arrangements to make sure they get the vaccination as soon as we're allowed to do so.
That's great. Thank you very much, Jessica. Andrew, I'm just conscious of time, so if you don't mind, I'll get you to answer this last question. And the question is, and we did highlight this in one of the slides which Jessica went through, which Sam went through, sorry, can training be offered to councillors and community leaders on how to respond to conspiracy theories and encourage uptake?
I would be really grateful if we can come back to you on the how, but it's imperative that we do, and I wouldn't limit it to those groups. So absolutely need to make sure we are on top of this, and that will be a key focus for us. So let us take away the best mechanism for that, but it's imperative that we do. We're already in contact. Some colleagues may have seen some of our notices around the faith and community group interactions that we've had, and they will only grow, and we need our social media presence to reflect that for those people who are engaged in that way. So very happy to make a commitment on that. Equally happy to receive views and thoughts about how that's best delivered and how we best help with that. So Lucy, given the time, I'm going to close the session, but I'm going to close the session. So I have to be clear. I spend most days, all day, saying thank you to people. It is frankly humbling, the level of support and just hard effort and work that's going into this programme right across the 6 bars. I'm really grateful, not just for people's time to engage in this session, but the support that is happening before, after, as well with the programme. Just to be clear, however, this is a complex programme, and we already know, and we are absolutely certain, the recurrent theme is that we will not get everything right all of the time. So we are adopting that learning approach as well, but hopefully it's a responsive one. So I guess at the moment we have clearly more work to do on data, clearly more work to do, particularly on inequalities, communication, and the way in which we help people help us, to use sort of Sam's phrase earlier. But we're absolutely committed to that cause, and I do think we've hit the ground running on this programme at the moment. Thank you. And as I said right at the start, this is our first session, albeit that the future ones most likely be localised, although if people feel running this type of South East London session again is helpful, we will of course respond to that positively. Many thanks.